Assalamu alaikum, sir. A very good night to you all. This is Rajiv Hossain Raz, ID 171299969. I would like to talk about my presentation topic is feature evaluation and treatment of coronavirus COVID-19. Here I go. Coronavirus disease 2019 COVID-19, the highly contagious infection disease caused by severe acute respiratory syndrome. Coronavirus has had a catastrophic effect on the world demographic, resulting in more than 2.9 million deaths worldwide, emerging as the most consequential global health crisis since the era of the influenza pandemic of 1918. The COVID-19 pandemic in Bangladesh is part of worldwide pandemic of coronavirus disease 2019. COVID-19 caused by severe acute respiratory syndrome coronavirus. The cases were reported on 8 March 2020 by the country Epidemiology Institute. IEDCR. Since then, the pandemic has spread day by day over the whole nation, and the number of affected people has been increasing. Bangladesh is the second most affected country in South Asia after India. Clinical manifestation of COVID-19. The media and incubation period for SARS-CoV is estimated to be 5.1 days, and the majority of patients will develop symptoms within 11.5 days of infection. The clinical spectrum of COVID-19 varies from asymptomatic or parasymptomatic forms to clinical illness characterized by acute respiratory failure requiring mechanical ventilation, septic shock, and multiple organ failure. Most common symptoms: fever, dry cough, tiredness. Less common symptoms: asthma and pains, sore throat, diarrhea, conjunctivitis, headaches, loss of taste or smell. Serious symptoms: difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Evaluation: a detailed clinical history regarding the onset and duration of symptoms, travel history, exposure to people with COVID-19 infection, underlying pre-existing medical condition, and drug history should be elicited by treating provider. Patient with typical clinical signs suspicious of COVID-19, such as fever, cough, sore throat, loss of taste or smell. Self-care treatment. After exposure to someone who has COVID-19, do the following: call your health care provider COVID-19 hotline to find out where and when to get a test. Cooperate with contact tracking procedure to stop the spread of the virus. If testing is not available, stay home and away from others for 14 days. While you are quarantined, do not go to work, to school, or to public place. Ask someone to bring your supplies. Keep at least 1 meter distance. Wear medical masks. Clean your hands frequently. Keep the room well ventilated. If you share a room, place beds at least 1 meter apart. Stay positive by keeping in touch with loved ones by phone or online, and by exercising at home. Medical treatment. Scientists around the world are working to find and develop treatment for COVID-19. Optimal supportive care includes oxygen for severely ill patients and those who are at risk for severe disease, and more advanced respiratory support such as ventilation for patients who are critically ill. Dexamethasone is a corticosteroid that can help reduce reduce the length of time on a ventilator, and save lives of a patient with severe and critical illness. WHO does not recommend self-medication with any medicine, including antibiotics as a prevention or a cure for COVID-19. COVID-19 vaccine work. The COVID-19 vaccine produce protection against the disease as a result of developing an immune response to the SARS-CoV virus. Development immunity through vaccination means there is a reduced risk of developing the illness and its consequence. This immunity helps you fight and the virus if exposed. Last of all, I would like to thank my honorable teacher right by me for listening presentation. Thank you.